I understand we're live now. Thank you everyone for joining us for this virtual press conference with WHO in the Western Pacific region. Today is a special one in our series of virtual press conferences. We've been doing these for the past several months, giving you updates on the current situation with the coronavirus disease in the region. Today, we are doing that, but in addition, we're also going to give you some information, updates, and opportunities to ask questions about items being considered by the 71st session of the Regional Committee for the Western Pacific, which is taking place virtually this week. It kicked off today. So before I hand the microphone, as it were, over to our panelists, I'll do a brief round of introductions. Of course, our main speaker today is Dr. Takeshi Kasai, the Regional Director for the Western Pacific. He's joined today by Dr. Babatunde Olawukere, who's our Regional Emergencies Director. Also, Dr. Huang Tran, Director of Disease Control in the region. Mr. Martin Taylor, the Director of Health Systems and Services. Dr. Socorro Escalante, our Coordinator for Essential Medicines and Health Technologies. And Dr. Rabi Abeyasinge, WHO representative to the Philippines. So without further ado, I'm pleased to hand over to Dr. Kasai in Manila to give us some opening remarks. Over to you, Dr. Kasai.
Thank you, Liv, and good afternoon to the journalists who have joined us today and people across the region who are watching online. As you may know, the Western Pacific region is one of the 6 WHO regions, and it's home to around 1.9 billion people. A characteristic of this region is its diversity. It includes the world's biggest country and the smallest. It has highly developed countries, fast-growing economies, and small, sparsely populated island states. This region is dynamically changing with both rapid urbanization and the world's fastest aging population. The Regional Committee taking place this week is our highest governing body. It's where Minister of Health and senior officials come together once a year to decide on policy relevant in this region and decide how WHO should focus its support to countries, and they hold us accountable for our performance. And this year, we're organizing the Regional Committee virtually for the first time in our history. At my first Regional Committee as a Regional Director last October, Minister and senior officials adopted a document called For the Future, towards the healthiest and safest region, which identified 4 priorities, of which one was health security. But none of us could have imagined how quickly the future would arrive. COVID-19 is a testing of our health system, our capacity to get people the information they need to protect themselves, and the resilience of societies and economies. Today, I reported to the Minister of WHO on the WHO's actions to respond to COVID-19 in this region since 31st December, while driving forward our collective vision to make the Western Pacific the healthiest and safest region. For the details, I refer you to the speech I gave to the Regional Committee this morning. And now I would like to hand over to Dr. Babatunde Olawukere, our Regional Emergency Director, to give an update on the current COVID-19 situation in the region. Babatunde, please.
Thank you very much, Adi, and good afternoon to our colleagues online as well as journalists, media. I'd like to use this opportunity to provide you with an overview of what is happening in the region, as well as just to give you also some idea of the responses that have been carried out by our member states together with support from WHO. So the first slide you can see, this shows you information as of today, where we have over 35 million cases globally. So as well as over 1 million deaths also globally. And you can see clearly there the 10 countries with the highest number of cases. Now, when we look at this particular map, for simplification, the darker the color, the more cases have been reported in the last 7 days. And you will see that the Western countries or member states of the Western Pacific region are very light in color. And so clearly showing that they are reporting less cases relative to other parts of the world. Next slide, please. Now, this particular slide shows you the evolution of the outbreak across, if you could just click on the, thank you very much. It shows you the evolution of the outbreak over time, starting from when the first case was identified in the region in China to the first case outside China, then looking at when the first case was reported, when the DG declared a pandemic, and then when the first case was reported in the Pacific Islands. Can you just hold the clicker, hold the pointer, it's okay. Yeah, and then you can see then a number of pointers will come up, the first 1 million cases, and then followed by the evolution of the outbreak, peaking in the Americas, now passing 20 million cases. If you, sorry, go back, please. Yeah, so just keep the pointer, yeah, just keep it on there. Yeah, just let it run, let it run. And what you'll see now is just a clear evolution of the cases over time. Just let's go to the next slide, please. Next slide, yeah, okay. And so essentially the previous slide was to show you the evolution of cases over time, showing that now we are in a position where the Americas have the most cases globally, and that Africa region of WHO and the Western Pacific region of WHO are the WHO regions with the lowest number of cases reported. Now, in terms of how we have progressed, or how have we got here, you can see that we have around 630,000 people across the region who have had confirmed coronavirus COVID-19, as well as over 13,000 deaths. Now, countries and areas in the region continue to be at different stages of the epidemic, as you may realize, and we have several countries reporting increases in cases, as well as localized community transmission. However, we have the opposite in other countries where we see case numbers are coming down. And this is really, again, due to solid implementation of targeted localized measures, along with enhanced surveillance efforts, good contact tracing, as well as supportive community behavior. And in those instances, we have reduced impact on other parts of the country, as well as a minimalization of the economic and social disruption that is seen elsewhere. And I think that is my, oh yeah, sorry, that is, the next slide, please. I have one more slide. Yeah, so this is the last slide. And so this will just summarize the response for you in terms of the Western Pacific region. So overall, case numbers and proportion of fatal cases are low, as we have seen, in comparison to other WHO regions. Many of our member states have continued to strengthen their surveillance capability, and essentially this is to ensure that transmission is quickly detected and effectively managed. Pacific Island countries and areas, a number of those still have no cases and must remain vigilant, however, as must all of us, as we now try to move back to opening borders, as the virus is really still circulating globally, as you can see, very much so in the Americas and Europe. Member states responded rapidly, effectively. There was good leadership. And what we also have is the preparedness of health systems to respond. And this has been facilitated through 15 years of the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, or otherwise known as APSED. And then finally, we, of course, have areas or countries where new localized community transmission is taking place. And this is mainly due to breaches, exemptions, or relaxations of non-pharmaceutical interventions, such as allowing the congregation of people in settings which are at high risk. And thank you very much, Adi, back to you.
Thank you very much, Babatunde. Now I'd like to spend a few minutes on three of the important issues being addressed by member states at the regional committee this week. The first is the immunizations. Member states are going to consider a strategic framework to strengthen and expand immunization system and shore up preparedness for public health emergency related to vaccine preventable diseases. Vaccines are one of the safest and most effective tools to fight diseases. But children in high-risk communities in the regions are still affected by outbreaks of old diseases like measles. There are also new vaccines, for example, against cervical cancer, pneumococcal diseases, and seasonal flu. And we need to make sure we're reaching the adolescents and older people who need them. We also need to make sure our immunization system are resilient enough to withstand major public health emergencies. The framework being considered by the health leaders this week sets out 18 strategies to work towards making the region free from vaccine preventable illness, disability, and death by 2030. The second is the action framework on access to safe and affordable surgery. Surgery saves lives and improves the quality of life of millions of people every year. And most of the people need surgical care at some point in their lives. For example, C-sections to deliver a baby, set a broken bone, or remove a cancer, or manage a complication of diabetes. Surgery is cost-effective, and it's a vital part of the universal health coverage. But access to the safe and affordable surgery remains limited in this region due to geographical challenges and financial barrier. There are also challenges for patient safety due to the complexity of care and the risk of infection. This item is about the surgery, but it's also about transforming a health system so that all services are accessible and of good quality. And thirdly, we will consider a regional action plan to promote healthy aging. Now, this item is about transforming not only health system, but also the societies. We had a panel discussion on this topic at the regional committee last year. At that time, we were thinking about it in terms of health services for the elderly. But after 1 year of discussion, we now recognize that what is needed is a transformation, not just the health system, but also the societies. And doing that, that would have a benefit for everyone. Our region is the fastest aging in the world. Today, there are already more than 240 million people over 65 years in the Western Pacific. And this number is expected to double by 2050. This presents health, social, and economic challenges. But they can be also turned into opportunities. When societies become more age-friendly, people who live longer and healthier can be active and contribute to their societies through paid or unpaid work, or consuming and investing, or passing down knowledge and traditions, and acting as a caregiver for young family members. This kind of transformation takes time. So we need to get started as soon as possible. There has never been more attention on health than there is today, on the links between the health of people and the economies. We're in a unique moment in time, not only because of the pandemic, but because the pandemic has created the condition in which we have the opportunity to make a choice that change our future. Our region is diverse, and different countries are experiencing different situations in relation to COVID-19. 15 of our Pacific islands are yet to record a single case. But as long as the virus is circulating in the world, no country is safe, and there is no sign that the virus is going away quickly. With that in mind, there are two important things. One, we must continue to make every effort to build and sustain the new normal. And two, to maintain the principle of solidarity. In my last press briefing, I described our region is entering a new phase. I shared that countries in Asia and the Pacific were exploring more effective and sustainable response to both control the virus, but also bring back the economy and also the social life. Making this work requires effort and collaboration from individual, communities, business, and the government. Over the past 9 months, I've observed impressive solidarity in the region, from technical exchange on issues such as laboratory testing and clinical management, to working together in the joint incident management teams, and commitment to support other countries' access to a COVID vaccine should one become available. It's essential to remember that we are in this together, and we can only get out of this together. Hundreds of thousands of people in this region have been infected with COVID-19, and more than 13,000 have lost their lives. I believe that we have an obligation to those people and to their families, not only to get these diseases under control, but to build a better future. Thank you very much.
Thank you so much, Dr. Kasai. That now concludes the opening remarks portion of this press conference. So we will soon begin the portion dedicated to questions and answers. We've received a lot of questions already, and we'll get to as many of those as we can today. Of course, the time of the regional director and our other panelists is limited, but we will ensure we get to at least one of all of those that we've received from each of the outlets ahead, and as many that we can that are submitted live as well. So if you haven't submitted a question already, please note that you can do that using the chat function. And in addition to COVID-19, as Dr. Kasai mentioned, there are a number of other important issues being addressed at the regional committee this week, and there are lots of experts in the room who can help answer your questions on those topics. So don't hesitate to send them in if they're about the other issues also. Let's get started now with a question from Marianne Benitez of the Hong Kong Standard. Why is the mortality rate lower in Asia Pacific? What are the factors behind why this region seems to be in better shape than other WHO regions? Is it the wearing of masks, or society being united together against the virus, or other factors? I'm going to put that one to Dr. Kasai, please.
Do you want to give the floor to Babatunde, or you want me to answer, or this?
We can start with Babatunde, and perhaps you can add any comment.
Okay, thanks very much for the question. And now, as I understand it, the question is relating to the Pacific and why they appear to have a lower mortality rate. Is that correct? Or
Asia Pacific, the Western Pacific region overall compared to other WHO regions.
Okay, thank you very much. So within the Asia Pacific region, I think what we have seen is a very clear and early response to the pandemic, to the virus, which causes the pandemic. And we have also seen preparedness. And this preparedness is based on 15 years of the use of the Asia-Pacific strategy for emerging diseases and public health emergencies. And many of our member states also have built up their surveillance capacities, they've built their laboratory capacities, and they've also built on their communication and community engagement. So the early implementation of these measures, along with non-pharmaceutical interventions, was very, very constructive in helping us to keep the number of cases in the region low. There's also been very good leadership within the region as well, and that has really helped, along with the political commitment of our member states in order to ensure the safety of their populations. Over to you, Liv.
Thanks so much, Babatunde. Adi, did you want to add anything, or should we go to the next question? Okay, we'll go to the next question. We've got a long list, so that's great. The next question I'd like to ask is from Jing Cave with Philippine News Agency. How can countries easily adapt to the new normal, and how does WHO support countries in this regard? Adi?
Liv, thank you very much for that question. In our previous press conference, I have mentioned that Asia Pacific is entering a new phase for the COVID-19. Given the virus is circulating around the world, this may not go away that quickly. And therefore, government is going to deal with the multiple surge, and we have to find a sustainable way of intervening in that. And then we pick up three important points. One is that vigilance to detect those surge early and do targeted response. And two is continue to improve our capacity of health system, capacity of the public health to do such as a very rigorous contact tracing, and then also the capacity to plan and act to protect the vulnerable. And third is, I know everybody's tired, but continue to encourage people to take healthier behavior, such as washing hands or having mask or keeping a physical distance. And also business sector to find a way to operate in such a way to minimize the risk. And of course, the government to set up some environment for individual and business sector to do behavior, healthy behavior, and operate in such a way. I know it's not that easy things to do, but the more we actively create the new normal, I think we can bring up those economy and then the people's life. And therefore, it's very important for all people to continue to practice this healthier behavior and create and participate in bringing and creating this new normal.
Thanks so much, Dr. Kasai. I've now got a question about the Philippines. This one's from Rafi Bosano at ABS-CBN, but we received similar questions also from CNN Philippines and also NPR. While statistics in the Philippines show a downward trend in the number of COVID cases, this only occurred 7 or 8 months into the pandemic. Other countries have been more successful in suppressing it. What does WHO see as a factor as to why the Philippines continues to struggle with containing the virus? Perhaps, Babatunde, you could get us started on that, and WR Philippines, Dr. Abea Singh may like to complement after you've provided an initial response.
Thanks a lot for that question, Liv. And so I think what we need to understand, or what we need to recognize, is that these challenges are not unique to the Philippines. Other countries are also in a similar position. What we do know is that the government took fairly early action to implement movement restrictions, and this may actually have prevented greater rates of infection and also saved many lives. However, lockdowns, if we only look at lockdowns alone, which have been used to suppress the virus, we know that you actually need more than just one intervention. So there must be a number of control measures which are all implemented together or at the same time or in conjunction with each other. And these, of course, would include the wearing of face masks, the washing of hands, the recognition of using respiratory hygiene and social distancing. And so taking all these together, these would be useful. Clearly, the Philippines has a number of particular challenges as well. And so they had many people who were working abroad and others, and they had to return home. And again, this may have seeded some infections, but I think where you have movement controls along with other implementations of measures to suppress the vaccine, to suppress the virus, then we are much more likely to have better control. And we also have to recall that this particular disease is one which is facilitated by human to human transmission. And so therefore, we do need, as Adi said previously, behavioral change. And so therefore, we do rely on individuals working together, as well as communities and businesses to all come together to ensure that they implement behaviors which will be conducive to reducing transmission. Over to you.
Thanks so much, Babatunde. Rabi, would you like to add anything to that?
Thank you, Liv, and thank you, Babatunde. Yes, if I may add, as Babatunde rightly pointed out, the Philippine government was very proactive in the enforcement of the non-pharmaceutical interventions and in ensuring that there were mobility restrictions. However, as WHO has been saying from the beginning of this outbreak, in the absence of specific therapeutic agents or vaccines, we need to implement a comprehensive response that includes solidarity across regions, across cities, across countries. And we need to ensure that besides the NPIs, we need to have in place mechanisms for early diagnosis, contact tracing, and management of positives by early isolation and quarantining of close contacts. So when we look closely at the situation in the Philippines has done a lot of those things, but there's still room for improvement on the harmonized, speedy contact tracing and management of close contacts and early isolation of positives. Delays in doing this have resulted in more secondary cases happening and more secondary transmission occurring. So as the government continues to improve its response, there are now measures in place to strengthen these aspects, and we believe that that is now contributing to a gradual decline in transmission. Thank you.
Thank you so much, Dr. Abeysinghe. We have a number of questions, many questions, in fact, about a COVID vaccine. So short of putting them all individually, I'm just going to ask that we start with a bit of an overview, perhaps first by Dr. Socorro Escalante, and then perhaps Dr. Kasai may want to add to that on where we are in terms of a COVID vaccine and how countries in this region may be able to get access to an eventual COVID vaccine. Could you kindly get us started on that, Dr. Escalante?
Thank you so much, Liv. I'm going to give three general overview on the COVID-19 vaccines. The first point is about the landscape of the vaccines. The second point is about the COVAX facility, and third on the solidarity trial. So first on the landscape of the vaccines, currently we have 193 in the pipeline that is recorded in the WHO monitoring of vaccines. Out of this, there are 42 that are already in a more advanced clinical trial, that is trial in humans, and 10 are already at phase 3 clinical trial. Of these vaccines, there are around 9 that are candidates for that will be included in the COVAX facility that is currently supported by the CEPI, that is the Coalition for um, Epidemiologic Partnership Initiatives. And then there are also 9 vaccines that are under discussions to be by the Bill and Melinda Gates Foundation that may also be included in the COVAX facility. Now, having touched on the COVAX facility, I would like to also give key information. First, the COVAX facility is a mechanism that is established at the global level to ensure that all countries have an equitable access to the earliest available vaccines that are proven to be safe, effective, and of good quality. So the COVAX facility is collaboration between the CEPI, WHO, and Gavi. The CEPI is responsible for looking at the research and development of these vaccines. Gavi, on the other hand, is mobilizing support in terms of financing for procurement of these vaccines. And WHO is providing support in terms of regulations, meaning ensuring that the vaccines are safe, they are of good quality, and they are effective. Currently, under the COVAX, in terms of the participating countries, there are 198 countries that have signified or have already committed their intention to participate in the COVAX. 76 of these countries are self-financing, and 92 are under the COVAX Advanced Marketing Commitment category. So just to explain a little bit on the COVAX AMC, this is the mechanism whereby countries who could not finance the procurement of their vaccines are covered by Gavi by mobilizing funding from ODA and other donors. So in the Western Pacific region, there are 15 countries that are part of the AMC, and 6 have already committed to self-financing for the vaccines. So lastly, I would like to touch upon the solidarity trial. So the solidarity trial is also another mechanism for WHO to facilitate the early access of safe and efficacious vaccines. And this is being organized by WHO headquarters and is now being rolled out also to the regions and to the countries. As of October 2020, there are 17 applicants that are now being considered to participate in the solidarity trials. And I know there are going to be specific questions around this, particularly on the criteria for selection of vaccines, as well as on the criteria for which countries the clinical trial should be undertaken. And maybe I'll touch just briefly on the criteria for selection of vaccines that will be included for clinical trial. The Global Steering Committee will look at the safety profile of the vaccine, the potential for efficacy, also looking at the vaccine stability, and also the practicality of implementation, meaning whether the vaccines are manageable, the regimens are manageable, considering also the resource settings of countries. And of course, another criteria will be the vaccine availability. In terms of looking at which countries are going to host the clinical trials, so the primary consideration for selection of the site for clinical trial is a country with ongoing transmission. But also, in addition to that, it's important to look into the preparedness and readiness of country to conduct this clinical trial. And they're going to look into the availability of experts and investigators looking at the clinical trial sites, whether there is a committee who could look and evaluate the protocols for approvals. It's also very important to look at laboratory readiness and the capacity to report, establish data systems, and for monitoring of the clinical trials.
Thank you so much, Sok. Lots of information, very rich response. Dr. Kasai, I don't know whether you had anything you wanted to add to that about vaccines. Okay, great. We have lots more questions to get to. This one is about the vaccine delivery systems in the region and whether they're ready for a possible COVID-19 vaccine. This question is from Jenny Ravello from DevEx. What particular challenges do you see in terms of vaccine delivery for COVID-19 in countries of the region? Could I ask Dr. Tran to respond to that one, please?
Thank you very much, Liv, and thank you very much for the question. I will start by going back to the 2009 in conjunction with H1N1 pandemic. And at that time, WHO developed the vaccine deployment plan as a part of pandemic preparedness plan. And in 2010, there was 8.7 doses of H1N1 vaccine delivered to 16 countries. And the VDI team in the Western Pacific region has been constantly maintaining this with quarterly assessment of logistics, including the cold chains capacity. And we are using this information to update the vaccine deployment plan. And next month, in November, the Western Pacific region, WHO, will be holding the regional workshop on vaccine and immunization safety to prepare for the safety event during COVID-19 vaccine deployment. And we also planning to convince the simulation exercise with the WHO health emergencies on the vaccine safety events that will support the member states to build capacity and to be ready for COVID-19 deployment. One thing that we don't know is about the volume of the vaccine. So it's obvious that it wouldn't be enough for everyone from the beginning. So the deployment of vaccine could be conducted in a phased manner. And the initial targeted groups should be the high-risk groups, such as vulnerable population, aging population, and healthcare workers. And it will be more challenging to reach the elderly, and because it's different from childhood immunization program. So we will be considering the special vaccination posts and care may be needed to establish for aging population more than 65 years old. And also another issue that need to be taken into consideration is the temperature for the storage of vaccine, because some kind of vaccine like the viral vaccine may need to have a lower temperature. And as our Adi already mentioned in the beginning of the briefing, that this week we are going to discuss on the regional strategic framework on vaccine preventable diseases and immunization. And in this strategy, we are also discussing on how to ensure that the preparedness and response of the immunization program for the events that need to have immunization response, including COVID-19 vaccine. Thank you very much.
Thank you so much, Huang. We have also a number of questions linked to what Dr. Escalante began speaking about earlier in relation to vaccine trials and the Solidarity trial in particular. Carolyn Bonquin from CNN Philippines, as well as journalists from ABS-CBN and the Philippine Daily Inquirer, have sent us similar questions. Basically, is there an update on WHO's screening process of vaccines for the Solidarity trial? May we know when the trial will begin in countries of the region, and will there be more trial participants in countries that have more cases, such as the Philippines? Over to you, Dr. Escalante.
Thank you so much, Liv. As I mentioned a while ago, there are 17 vaccines that are currently evaluated to potentially participate in the Solidarity trial. However, we do not have any information yet up to the stage of the assessment, but WHO will have a mechanism to publish which vaccines will go into the solidarity trial. In terms of the timeline, though, WHO has targeted that the pilot trial will be starting by the end of October, and that the first results of the pilot trial may be released by January. So these are the very rough timelines that we have. Currently, we are still in the process of advocating two countries who would hopefully be part of this solidarity trial for vaccines. And WHO has already released what we call an assessment tool for the countries to assess their readiness to undergo, to be part of the clinical or to host the clinical trials. So from time to time, updates will be released by WHO as the process will proceed. Thank you.
Thanks so much, Dr. Escalante. And before you turn your microphone off, I have another one for you on vaccines. This time, it's not about the solidarity trial specifically, but about the time frame. There's a question from Alden Monson from Kyoto News. What is the timetable that WHO expects when a COVID-19 vaccine will become widely available and affordable for the general population in the Western Pacific region?
Thank you so much, Liv. There have been varying targets in terms of the timeline. As some of the targets anticipates that by middle of 2021 there might be some initial doses of vaccines, but generally when we are going to look into the target of COVAX, it's by the end of 2021 that they are trying to come up with the first 2 billion doses that will be allocated to all countries who will be participating in the COVAX. Of course, outside the COVAX, there are other vaccines where the progress of the clinical trial is ongoing. For example, we have vaccines that are being developed in China that are already at the stage 3 clinical trial, and we know that the clinical trial is going quite rapidly. We are also aware that there have been some authorization that for 4 vaccines in China and 1 vaccine for Russia. So we might be looking at some vaccines that are going to enter the market earlier than the COVAX. So these are now the information that we have based on the information that are shared by the national regulatory authorities in countries.
Thank you so much, Dr. Escalante. We still have lots more questions on vaccines, but I'm going to move on to another topic for a little while first. This question comes from the Straits Times, Joyce Teo. Oh, no, that one's on vaccines again. Given that multiple COVID-19 vaccines may emerge and be used around the world, will this be an issue as more countries start to welcome travelers again? How important is it for countries to agree on which vaccines to recognize, and how can they do so? We'll start with Dr. Escalante again, it looks like.
I think, Liv, fundamentally, my basic answer would be vaccines that would have to be proven to be safe, efficacious, and of good quality would be the main criteria for WHO and countries to recommend the deployment of vaccines. In terms of the allocation, particularly for small island countries, there has been a lot of discussions within the region on how the region can support small island countries to access these vaccines, considering again that in terms of the prioritization of the vaccines, that initially we will only be able to cover around 20%. So discussion on whether or not this 20% will be enough, the 20% of the population of a small island country will be enough to give protection and to help the country come back to normal economic activity. Those are still in the discussions for now. But what I would say is, again, we need to be very realistic also that though our primary goal is to protect the small island countries, the limitations in terms of the volume of the vaccines that are going to be produced initially would not be very promising in terms of the volume. So we might have to go down again to the basic of our agreed allocation criteria across the different countries in the world.
Thanks so much, Dr. Escalante. We have a question from Julie McCarthy with NPR. Can we please provide an assessment of what's happening in the Pacific Islands? How have they fared in the pandemic? What have they done that's worked? How vulnerable do they remain? And what's the best course of action for them to follow to contain the virus or continue to keep it out? Dr. Kasai, would you like to speak to that one?
Thank you very much, Liv, and thank you for that question. First and foremost, the Pacific is a priority for WHO because of their vulnerable conditions. They have a very limited healthcare capacity, and also they're living in a very difficult conditions. And what also worries us is that the people who have some sort of non-communicable diseases, which is known as a high risk, has significant proportions existed in the Pacific island countries. But in the same time, we see Pacific, such as a community, is very strong in the Pacific, which is a very important component for responding to COVID-19. And we have been observing in the past 9 months very strong partnership in the Pacific. And we are also pleased to observe that the Pacific Island countries' leaders took a very strong actions at the earlier point. Therefore, we still see so many countries free from COVID-19. I think they are definitely in the right directions in continuously upgrading their capacity to respond to COVID-19. As far as the virus, again, circulating somewhere around the world, no country is safe. And it may not apply today, but our experience in 1918, the Pacific, that area is the last to have the virus coming in, and some country had a very devastating situations. So what we wanted to work together with the Pacific Island countries is to continue to be vigilant and then continue to upgrade their capacity to respond to COVID-19, and using those strengths, such as a community, let them own and then be ready to respond to COVID-19. And also, I already touched upon the high rate of non-communicable diseases as a background, which is a high risk of COVID-19. Why not? Not just for COVID-19, seize this moment and address those non-communicable diseases. So we can use this as an opportunity to create the Pacific Island countries more healthier place. And of course, as Dr. Escalante touched upon, we wanted to work together to make sure that the Pacific Island countries would have a fair share of the vaccine. Thank you very much.
Thanks so much, Dr. Kasai. Staying in the Pacific for a while, we have a question from Renee Kahukura Iosefa from TV1 Samoa. What is the forecast of COVID-19 impact on Samoa? Would you like to answer that one, Dr. Kasai, or someone else from the panel?
Liv, thank you very much for that question. And again, really appreciate the interest from Samoa to pose the questions. Samoa, as like other Pacific Island countries, they have been successfully, preventing virus to come in. And that is because of a very strong leadership prompted in taking action earlier days. And I've been observing that they have a measles outbreak and they responded and they use that capacity in responding to COVID-19. But as already mentioned, that as far as the virus is circulating somewhere around the world, no country is safe. So we really wanted all the Pacific Island countries to continue to be vigilant and continue to upgrade their response capacity. And I also touched upon the community. And in relation to the community, again, I wanted to reemphasize that in Samoa, the statistics shows that more than 80% of the people have some sort of non-communicable diseases. And like 30% of the people have a hypertension. It is very important to address this issue. And they have also a very good program called PENFA Samoa. So again, not just to respond for COVID-19, but I really hope that countries will continue to organize this program so that they can make Samoan people not high risk to the COVID-19. Thank you very much.
Thanks so much, Dr. Kasai. One more that we have from the Pacific while we're still in that part of the region. We have a question from Diana Gomez Mendoza with the Pacific Island Times. Studies say that COVID-19 thrives in cold and dry climates, such as those in the Pacific Islands. Since countries in the Pacific Islands are mostly COVID-free and most Pacific Island governments shut their borders early in the pandemic, can we conclude that science, more than local policy, has contributed to these islands' success in preventing COVID? So a question about climate and what impact, if any, that has on the spread of the virus. Not sure whether Dr. Oluwokere wants to give that a response or whether there's someone in the other room that wants to give it a go.
I can make an initial answer for that, Liv, and then maybe somebody else can supplement if they so desire. So thanks very much for that. So we clearly know that the Pacific climate is warm and humid. And although there has been a lot of speculation since the beginning about the effect of climate, weather, and the seasonality on the actual virus itself, we've seen that all countries around the world with all types of different climate have all been affected by the virus. And so this is clearly showing us that the virus can thrive in any type of weather or climate. Rates of community transmission, we know, and are largely driven by individual behavior and hygiene. And these are heavily influenced by what we now call physical distancing measures. And so environmental conditions can play a role in transmission, humidity, temperature as well, and they can then have an impact on when actual transmission of the virus occurs. Countries in the Western Pacific are not experiencing large-scale community transmission, as we can see, because of course they've implemented many measures which actually will prevent transmission. The real initial closing of borders, the contact tracing, and then the enhanced surveillance measures, early identification of cases, isolation of cases, and tracing and quarantine. So all of these measures have helped reduce transmission within the Pacific. And as we can see, so many of the countries in the Pacific have not had any cases as of yet. But again, vigilance is required for that to continue. We know that lessons from SARS have also helped within the region, and also we know that there's a lot of collaboration, cooperation as well within the region, and taking that as a whole, this again has helped our health security and preparedness, and the role of ABSED over the last decade and a half has also been very influential in helping our member states to prepare and respond. Thank you very much.
Thanks so much, Babatunde. The next question we have is again from Marianne Benitez with the Hong Kong Standard. if a COVID vaccine won't be available to the general population until late next year, what can people do between now and then to avoid infection? Dr. Kasai?
Sorry, can you repeat the question again?
Sure. The question is essentially, if a vaccine is not going to be available to the general population until late next year, what should people be doing now to protect themselves against the infection?
Thank you very much, Liv. I think what is important is government to anticipate, to deal with the multiple surge and to find a sustainable way of making interventions. And on one hand, to control the infection, but on the other hand, to make sure that the economy and people's lives to be back. For that, we recommend that number one, countries to continue to strengthen their capacity to identify those surge as early as possible and do targeted response. And two, continue to improve their capacity of the health system. The more you have a capacity, you can have those cases. And two, strengthening the public health capacity, public health system, such as contact tracing. And third, we also wanted to make sure there's a plan and then the action on protecting the vulnerable, such as elderly. And lastly, we continue to advocate that the people would take their role, practicing the healthier behavior. This is the virus transmitting from human to human. So at the end, it is the people's behavior who can change how this outbreak would happen. So we wanted the government to, and then the people to continue to advocate and practice those healthy behavior. And of course, we also wanted the business sectors to explore the way that they do business in a lower risk. Thank you very much.
Thanks so much, Dr. Kasai. I think we are probably needing to wrap up probably a few minutes ago, but I'm just going to try and squeeze in a last couple of questions before we do. We've got one from Red Mendoza at the Manila Times. The Philippines has had over 320,000 cases of COVID-19, among the highest in the Western Pacific region. Is this the reason why WHO has chosen the country to be a part of the planned Solidarity trial? Can I put that one to Dr. Abeya-Singh?
Thank you, Liv, and I'll try to answer, and maybe Sok will add anything else. So the Philippines was not selected by WHO. Countries have volunteered for the Solidarity trial, and depending on the transmission levels where we can try out the vaccine, this is something which Sok already alluded to, because if you want to try out the effectiveness of a vaccine, you need to try it out where there is some level of transmission. And so the combination of these two facts, the expression of interest by the Philippines and the continuing levels of transmission, are both in favor of the possibility of actually trialing the Solidarity vaccine trials here in the Philippines. Sok, maybe you want to add anything else?
Thank you so much, Dr. Rabi and Liv. I confirm what Dr. Abeya-Singh has mentioned, and also to clarify a little bit on the process of the Solidarity trial. So again, as Rabi has said, WHO does not select the countries where the Solidarity trial is going to be undertaken. The process is for WHO to invite countries to participate in the Solidarity trial. Again, of course, there are certain basic criteria that will have to be considered, including the situation we're in. There must be some ongoing transmission of COVID-19. Once a country signifies its intention to participate in the solidarity trial, WHO will advise the country how to assess their capacity and readiness to host the solidarity trial. And then once that is undertaken, the solidarity trial will proceed. And I have already mentioned some of the criteria that will need to be in place before a country can participate in the solidarity trial. Thank you.
Thank you both so much. For the last question that we have time for today, I'm going to try to bundle a few together. We received questions from the Wall Street Journal and CCTV regarding the vaccines being made in China, and is there any discussion ongoing with WHO to facilitate access for Asian countries to get doses of those Chinese vaccines? And we also received a question from Jovik Yi at the Philippine Daily Inquirer regarding the Russian Sputnik vaccine, whether we can share an update on that. Perhaps you could address both of those in the final response that you give to this question, Dr. Escalante.
Thank you so much, Liv, for the question. First and foremost, again, we would like to reiterate what Dr. Kasai has mentioned in the previous press briefing, that WHO welcomes the research and development that has been ongoing for the vaccines. And there has been unprecedented progress in terms of the number and the types of vaccines that are being subjected for development. And of course, we appreciate the countries who are putting on the resources, not only financial resources, but the expertise and doing their best to facilitate the entry of vaccines into the market to protect the populations from COVID-19, not only in their respective countries, but also in all the countries in the world. For China, as I mentioned a while ago, we know that from the information that we have received from the National Health Commission, that there are already 4 vaccines that were granted emergency use by the Chinese government, and this is moving into very fastly into clinical trial. While at this point, China has already approached WHO on preliminary discussion whereby China may participate in the emergency use listing of these vaccines, and potentially to through this emergency use listing, that the quality and safety of these vaccines and efficacy could be assessed in a facilitated way, and then this could be made available for licensing in countries. So again, bottom line is that we appreciate that countries are really moving forward in terms of the research and development and potential licensing and deployment of these vaccines to countries. The second question on whether or not there has been an involvement of WHO into discussion with China on the countries in the Asia Pacific to access this vaccine. I think the principle is the same for every vaccine that is going to be manufactured in the world, that the goal of WHO is to ensure that all countries will have the access to the earliest vaccines that are proven to be safe, effective, and of good quality in the market. We know last point for China, that their willingness to discuss with WHO on the potential for EUL, or the emergency use listing, is a very good indication of the solidarity again in this region to support other countries to access the vaccines. On the Russian vaccine, again, this is an update from the last briefing. During that time, it was a very early stage of discussion between WHO and the regulatory authority of Russia. And now we know that Russia has already shared their data for the phase 1 and phase 2 clinical trial to WHO. And the Russian National Regulatory Authority itself has already given a conditional approval for the vaccines. Beyond that, we do not have information yet as to the deployment of these vaccines into other countries. Thank you, Liv.
Thank you so much, Sok, and thank you so much to all of our panelists today, and of course, all of the media across the region who have joined us. Thank you for your many, many questions. Apologies if we didn't get to it during the hour that we had today. My team would be happy to follow up on email with any that we didn't get to. So please just be in touch with us if you have additional questions that we can help with. Thanks to everyone today, and look forward to seeing you again soon. Bye-bye.